Yeah, I yield back.
Thank you. Recognize Mr. Gett, do you have questions that you wanted to ask?
Go ahead.
She's going to yield at this point. I now recognize Mr. Griffith for 5 minutes.
Thank you, Mr. Chairman. Dr. Frieden, I'm going to try to move through these as quickly as I can, so I appreciate short answers. You are aware that the Secretary of HHS is able to transfer funding from your department to other departments, isn't that correct? She can take funding from your department and stick it somewhere else, isn't that correct?
There is limited transfer authority as far as my understanding goes.
And when that happens, are you notified? Is she required to tell you that she's transferred funds?
As far as I know, yes.
And has the Secretary transferred funds in 2014 from the Division Handling Emerging and Zoonotic Infectious Disease? Yes or no?
I don't know the answer to that offhand.
Can
I could
you get
get
that
back to you with that
information
information.
for me?
Yes.
And I believe that that particular division would be a part of the Ebola response. I'm correct in that?
That is correct.
And do you know whether or not the Secretary has transferred money from the CDC's global health programs?
I would have to get back to you on that as well.
All right. Likewise, the same would be on CDC's Public Health Preparedness and Response Division.
I'd have to get back to you.
And both of those also would be a part of your Ebola response, wouldn't they?
Yes, they would. Yes, they are.
Now, you've indicated that you don't know about whether these monies were transferred. Do you know if any monies were transferred at all during 2014? Do you have any information?
There is a Secretary's transfer, but I don't know the details of what has been done.
Okay. And so you don't know the details. Do you know, so you would not know if any of this was transferred to help support the financial underpinnings of the of the Obamacare, ACA? I
do not know.
And likewise, do you know if any transfers were made to the administration, by the administration, for children and families to care for increasing number of unaccompanied children who arrived in the United States?
I'm not familiar with that financial.
You're not familiar with that, but would you get us the answers to all of those?
We can certainly get you those answers.
Likewise, I'm curious, the President apparently has requested a fair amount of money, and part of that related to Ebola, and part of that is a $1.54 billion in contingency funding. Some of that is supposed to go to HHS. It says in his letter to make resources available to respond to evolving epidemic both domestically and internationally. And I'm looking here, and it says that while $751 million of that is to go to HHS, it then talks about transferring those funds over to Homeland Security to increase customs and border control operations. Have you been in the loop on that? Do you know what kind of money you all are getting, and what are they talking about with customs and border control operations?
We work very closely with CBP, and we understand the need for contingency funds for Ebola in case, for example, Ebola would spread to another country that required a very intensive, extensive response. So that flexibility is a critical component of the emergency funding request.
Okay. And that funding request is, as was pointed out in an editorial by David Satcher, and I hope I'm pronouncing that right, a former director of CDC and a former Surgeon General, that request by the President is actually greater than what we've been spending on Alzheimer's. Isn't that correct?
I don't know Alzheimer's funding details offhand.
All right. And in regard to Mr. Klain, have you all had sit-down face-to-face meetings?
Yes.
And how many of those meetings have you all been?
Well, I'd have to get back to you with the exact number.
If you could get me that number, I would greatly appreciate that. That would be very, very helpful. Now, in some of the outbreaks in the past, historically in Ebola that have occurred in Africa, isn't it true that there are some times that we have an outbreak when we don't know where the disease actually came from, where it was picked up?
We have not identified definitively the animal reservoir of Ebola. We think it may be bats or bushmeat, but we have not determined that. We've determined it for a similar virus, Marburg, from research that CDC scientists did.
And the meat, I understand, the bats, would that be from excrement? I mean, how would the bats spread it, or are they eating the bats as well?
Well, it may be saliva. It may be carried. Bats, as mammals, carry a lot of pathogens that are similar to the pathogens that infect humans.
But this is just one of many areas where we are not really 100% sure of how the disease is spread, particularly in Africa.
Well, I would clarify, we're not sure of the animal reservoir. From all of the experience we've had, spread among human populations is from either unsafe care or unsafe burial in the outbreaks that we've assessed so far.
So, but that's once there's been an outbreak, but there are occasions when the outbreak just starts and nobody had it there before, so it couldn't have come from human contact. It had to come from this animal reservoir, and we're not sure exactly what animals carry it, whether or not it's, you indicated spittle, excrement, what else. We do know that it's transmitted if you eat a diseased animal. Is that correct?
It may be actually not so much the consumption of bushmeat, but the hunting and handling and cleaning of bushmeat, where you may get exposed to blood and other body fluids.
Okay. I appreciate it and yield back.
Now recognize Ms. DeGette for 5 minutes.
Thank you, Mr. Chairman, and I want to